Now, the third wave continues to hit hard in South Africa. This time, children aren't being spared. The National Institute of Communicable Diseases warns that more children have been infected in this third wave. Wits University vaccinologist Professor Shabir Madhi joins me now to speak more about this. Professor Madhi, I think this was quite a surprise to those of us, of course, not in the industry, in the health industry, because previously we were told that children don't necessarily get COVID-19, and that's why schools were then reopened by government, right? So what is the difference now? Is it the Delta variant that is causing this increase?
Good morning. So certainly the Delta variant is a major factor that's resulting in an increase, not just in children, but also in adults. So currently the peak rate of daily infections in South Africa is about almost 3 times higher than at the time of the peak of the first or the second wave. And that is because a virus that is much more transmissible, much more infectious, is currently circulating compared to the earlier variants. So it doesn't come as a surprise that across all age groups, the force of infection is going to be much, much greater than what we experienced in the past. When it comes to children, they have been more affected this time around, but again, as part of the larger infection, larger experience that we're having across all different age groups. What's important is whether children are still at heightened risk of developing severe disease. And right now, there's little evidence to indicate that as a percentage of infections, children are any more likely to develop severe disease with this variant compared to the earlier variants. So although in absolute numbers, the number of children that are ending up in hospital, and mainly children that have underlying medical conditions, and unfortunately, especially for children under 1 year of age, not school-going children, the number of infections that are ending up in hospital is greater than what we've seen in the past. But again, it's simply unfortunately a consequence of the circulation of the variant, which is much, much more infectious, at least 2 to 3 times more infectious, as an example, compared with the original virus that was circulating.
Now, we have been told numerous times that, it's a battle of the immune system, basically. Is your immune system strong enough to fight off the virus? We know, and we have been told that children have a better immune system compared to their elders unless they have comorbidities. But how is the death rate amongst children? We know you just confirmed from the NICD's report that the infection rate is going higher, but are the death rates also going higher?
So at this stage, there's no suggestion that the death rate is, when we talk of death rate, you can look at death rate as per 100,000 of the population of children, or the death rate of hospitalized cases. When looking at the hospitalized cases, what we call a case fatality rate, that hasn't changed much compared with the first and the second wave. But again, the death rate as per 100,000 of the population, that would increase. But again, the increase in children makes very little contribution to the total number of COVID-19 deaths that are occurring in the country. In addition to which, the age group of children that are most susceptible to dying from COVID-19 are not just school-age going children, but rather children under 1 year of age. And the reason for that is many of those children do have underlying medical conditions, such as being born prematurely, in addition to which they obviously got a relatively immature immune system, which makes it more difficult for them to be able to control the infection that is occurring.
I guess, Professor, this means that government should ramp up the efforts of vaccinating people and make sure that it comes down to children as soon as possible now.
Well, the chances of it coming down to children anytime soon in South Africa is fairly remote. Our focus really needs to be to ensure that we target age groups and risk groups and individuals that are at risk of developing severe disease. So right now the focus can't be on children. That might be a luxury that we can indulge in sometime next year. Right now we need to make sure that anyone above the age of 60, as well as individuals above 35 with underlying medical conditions especially, are prioritized, because we are trying to save lives rather than just preventing infections from taking place.
Professor, South Africa is obviously not performing to the level that government had promised or that they had thought in terms of this vaccine rollout. We're actually still lagging behind. So with the President speaking tomorrow as a vaccinologist, what would be your advice to him?
Well, we, at the moment, although we've peaked in Gauteng with a number of daily cases, over the next 2 to 3 weeks, we're still going to see an increase when it comes to hospitalization and death. For other provinces such as KwaZulu-Natal and the Western Cape, there's still an upward trajectory. So South Africa is far out of the woods when it comes to this particular resurgence. But at the same time, we need to balance livelihoods and have measures in place which will be most impactful in preventing a rapid rise of further infections, which is going to take place immaterial of what level of restrictions we're under. And what we need to do, the single most important tool that we've got available to us, which will have a minimal, not a minimal, but will have the least impact on livelihoods, is the banning of mass gatherings, especially indoor gatherings, because those sort of gatherings are directly or indirectly responsible for more than 80% of all infections. So we can have some latitude when it comes to curfew hours, when it comes to off-site alcohol sales, as an example. But unfortunately, the bottom line is that we know that this virus transmits very rapidly, it's mildly infectious. And when people start gathering, be it a group of 10 or a group of 50, especially when those gatherings are indoors, unfortunately, those sort of behaviors results in large number of infections over a short period of time, which pretty much ends up overwhelming our healthcare services.